Fleming lost her life, and an adult that was with her as well. And just a tragedy anytime someone dies, but of course when a 7-year-old is somehow caught in what appears to be some kind of a dispute between adults. um, you know, it's the adults that of course are the problem here. So just very sad about that today. There is an intense and an ongoing investigation about this. I can't really say much about it. There's a lot I don't know, but this is an ongoing investigation. But I just don't want to let her death pass without saying how heartbreaking this is, and honestly how infuriating it is. I mean, the easy access to guns in our community, the prevalence of drugs in our community, poverty in our community, all of those things lead to or contribute to this situation that we're in. So I'm infuriated about it, and I'm very sad about it. 7-year-old little girl. So that's all I'll say about that for now. But now, moving on. We're going to talk about COVID, we're going to talk about vaccinations, and of course, we're going to take your questions. COVID continues to get a little bit better every day. You're seeing that if you're watching the news. This is happening certainly in our region and around most of the country. That in the city of St. Louis, our numbers continue to be better than anyone else's in the region, any other county in the region. That said, they're still very high. But looking on the positive side of this, the city of St. Louis had, we have a 7-day average number of new cases of about 85 per day. That's 28 per 100,000. In terms of number of people in the hospital, these numbers lag a couple of days behind. 629 people were in the hospital yesterday with either COVID positive, and that dropped down to 569, or suspected COVID, that was 60. That's how we get to the 629. That's considerably better than it was if we look back to December 24th, just as a point of comparison. There were 929 people in the hospital. So exactly 300 people, either COVID positive or suspected positive, 300 fewer people in the hospital today than there were a month ago. And of course, hospitalizations do follow new cases. And as cases go down, hospitalizations go down. That's good news. Now, ICU, of the 629 people who are in the hospital with COVID or suspected COVID, 134 of them are in the ICU, and of those, 87 are on ventilators. So that tells you that there's still a number of very ill people that are in the hospital with COVID, but it is going in the right direction. And, I'll talk about vaccines in a minute here, but, as people begin to get vaccines, and as we get more and more people with the vaccination, and if we will continue with the mitigation strategies, wearing a mask, social distancing, we are very hopeful that both of those forces will continue to move these numbers down. Now, I'm going to remind you what our goals are, and these are of course interim. Our goal is none, but interim goals. City of St. Louis our goal is to have fewer than 35 new cases a day, and we're at 84 right now on average. Hospital admissions, our goal for the region is 40, and we are average 40 new people admitted, and we're averaging right now around 77. So we're just about double. But we were triple and more. So right now we're just about double the goal. Number of people in the hospital, the goal is fewer than 350 in the region, people in the hospital with COVID or COVID positive. And we are at 629 right now, so we are not quite double on that. And 700 would be double, we're at 629. And then the percent positivity rate, the goal is 5% or less. For the first time in a while, the city positivity rate is down at 9.5%. And that's a 14-day positivity rate. So, so that's some good news. And it's thanks to all of you who are following the mitigation procedures, mask wearing, social distancing, hand washing, keeping your bubble, your COVID bubble small. That's really what's causing these numbers to go down at this point in time. So stick with it, please. Stick with it for a while longer, because we all want these numbers to come down considerably more. Now, on to vaccinations. You can't help but have seen the news that Missouri is last in the nation, number 50, for percentage of our population that was vaccinated. 3.6% of our population had been vaccinated. Now, there's no sense to focus on the problem of that. Let's focus on the solutions to that. And that, of course, is to get a steady stream of vaccinations, of vaccine distributed out to all the vaccinators so that we can then have enough people to do the vaccinations and really work our way down through the number of the levels of people that are allowed to be vaccinated. And you know, right now it is EMS, fire department, first responders, police, corrections officers, people that are front-facing first responders, but it's also people that are over 65 and people that are under 65 with underlying health conditions. So the city of St. Louis, we expect to get tomorrow 3,900 doses, and we will be rolling out at the end of this week to our first responders and those folks that are in the approved groups at this point in time. There were 2 vaccination events. I believe I talked about one of them on Friday, but on Friday we vaccinated 441 was, I think, the final number of first responders, primarily EMS, fire, and police officers, over 200 police officers. So that was the 441. And then on Saturday, there was a public event targeted at seniors that was held at Southside Wellness Center, next door to it. And there were about 300 vaccinations given out there. There were a lot of people there. But everyone, it went till about 4:30. Everyone who was there and in line was able to get their first vaccination. And we thank Affinia Health for that, who was there with the State Department of Health and Human Services. Joe Palm was there. Dr. Randall Williams, who's the head of that department, was there. And so we are beginning to make some progress, and I think we'll make more progress as the days go on. So I hope everybody is willing to get the vaccine. I know everyone isn't, but you know, I hope that as more and more people get the vaccine without adverse effects, that it will persuade more people to get it. We've got to step up the rate. We've got to step up the supply of the vaccine. And if we can do that consistently, and of course it comes from the federal government to the state down to cities and hospitals and federally qualified health centers and those folks, all those folks. So we've got to keep that going, and we've got to have the vaccinators, the nurses, the doctors, the medical professionals who can give shots. We've got to have them, and I know they're going to be working hard over the next many months. So that is the situation with vaccinations right now, and I hope we get a much better report card as a state in the next few weeks. So, questions?
Many questions today, Mayor.
Lots of questions.
Starting with COVID and the vaccine. A couple of people have asked if you could clarify, when you talk about COVID and vaccinations in the region, how are you defining region and who is included in that definition?
Well, vaccinations or COVID numbers?
COVID, sorry.
Okay, COVID numbers. We look at the region, we look at the numbers in, of course, the city of St. Louis. We look at the numbers in St. Louis County, St. Charles, Franklin, Jefferson. And we look at the numbers across the river in St. Clair, but the numbers that we are reporting here for hospitalizations, for example, are from the 4 major hospital systems. So we look at that broader area as the region. We compare ourselves to the other counties that are in the regions.
Amanda's question has to do with the possibility of mass vaccination events. There has been talk about that statewide and in St. Louis County. Is it in part of the conversation in St. Louis City, and when might we see one?
Well, you know, we had an event on Saturday. I just talked about that. That was an open event to anyone in the public who was over 65. And we expect to do more of those. Now, you know, we are talking, we have to have the vaccine supply, and we need a way for people to get appointments for that. We don't want to have these long lines. But we will do big events, but we will also continue to do a number of small events, provided we can keep the supply going. Our priority right now is to get our first responders and folks that are working directly with the public at both of our jails, marshals, sheriffs, rangers, police officers, EMS, firefighters, getting all those people vaccinated right now.
Donna's question has to do with the notification system. She signed up and would like to know when she can expect to get a vaccination. I don't know if that means she's a member of the general public or one of the top tier categories. Her general question is, when can I get vaccinated?
Everybody wants to know that, Donna. When can I get vaccinated? I don't know if you're over 65. If you've got to be over 65 or be under 65 with an underlying health condition right now to qualify to get the vaccination. I think for much of the general public, it will be a while, but you know, it depends really on how much of this vaccine starts coming from the federal government to the states, and from the states to us. So you know, the supply chain at this point is a little bit unclear, but you know, we've got to step it up as a country. We've got to step it up.
Liz has a question about businesses not following COVID guidelines, including the mask requirement. Where is a place where they can be reported to the city?
622-4800 is the phone number for the Citizen Service Bureau. You can also go online and just go to the city website, and there's a click right there where you can make a complaint, and that's where you can file your complaint.
We have quite a few questions about the 50 out of Missouri ranking 50 out of 50. Patrick, Scott, Guy, Rebecca, all curious about why you think we are in that position and what state leaders can be doing to improve our vaccination rate.
Well, I think my focus here, why are we in that position? Not enough vaccine to the state, not enough distribution from the state outward. But I think placing blame, you know, might make you feel better for a minute. I'm all about figuring out how to fix it and figuring out how, and I know that the state is as well. So, you know, we just have to, federal government has to send it to the state has to send it to the hospitals, the municipalities, the federally qualified health center, all of the folks that are qualified to vaccinate people, and we just have to get it in arms. Nothing else matters except getting that shot in the arm. And you all know, and I know there's been a lot of talk about this on social media, but I said this on Friday. You all know I'm of an age that I qualify to get the vaccine. I am not getting the vaccine until every single one of my firefighters, police officers, corrections officers, all of these employees who are real first responders, until all those who want it get it. And I just think that's extremely important. You know, those folks are our priority right now. They are the helpers. You know, When you dial 911 and you need an ambulance or you need a fire truck or you need a police car, they are dealing 24/7 with the general public. And we know that there's a lot of COVID out there circulating around, very contagious. So we've got to get those guys and gals vaccinated first.
Mayor, what is your statement to folks who might still be skeptical about getting the vaccine or maybe don't trust it? Or would you tell somebody to get it?
Well, I understand that there is distrust in getting vaccines, in getting a new vaccine, but this is a very serious virus, and many people get really sick, and a number of people die from it. So far, the vaccine that people have received have had no real serious adverse effects. So I think everybody has to make that decision for themselves. Talk to the people that you trust. Talk to your doctor, talk to your nurse, talk to your pastor. Those folks who you trust are, for the most part, getting the vaccination. So I encourage everyone to get it.
Are you concerned about the variant arriving in the United States, that has arrived in the United States, arriving in the city of St. Louis and adjusting guidance potentially to keep people safe from it?
Sure, I'm just like everybody else. I'm concerned about new strains of this virus. And we know that it's in the U.S., and whether it's in St. Louis or not, we don't know that for sure, but it's likely that it is. It's believed that the current vaccine, both the Pfizer and the Moderna, are effective on the new strains, but these won't be the only new strains. I would expect that there'll continue to be new strains. So, sure, we're concerned. Everybody's concerned. We've got to do what we can to tamp down the spread of COVID, though, because the fewer cases we have, the less likely it is that these new strains will be able to mutate.
We've had a couple of questions about the 65 and above population. Chris's question is where would you recommend someone who's above the age of 65 go to find information about where and how they're able to receive the vaccination?
Well, Chris, first of all, be sure that you've registered with whoever your doctor is, or wherever, so whether it's a federally qualified health center, whether it's your personal private physician, the hospital system that they're associated with, you should be registered with all of those places. You should also register with the city of St. Louis, but the city of St. Louis is primarily a notification system about new information on the vaccine. We've had 33,000 people so far register in the city of St. Louis. But, register with BJC, register with Mercy, register with SSM. Don't get appointments, please, at more than one place, because then you would be, if you're holding 2 appointments, then somebody else, gets cut out of the deal. But yes, register. Stay in touch with your medical provider.
Bridget's question has to do with COVID and schools. How is that going? When do you anticipate that the educational institutions in the city might be eligible to receive the vaccine?
So, Bridget, education, K through 12 education, is eligible in phase 1B tier 3. So that comes right after older people over 65 and people with underlying health conditions. So when we can get through the older people and the people with health conditions, the next tier is K through 12, child care, information technology, water and wastewater. So, but there are a lot of people that are over 65 or 18 to 64 with underlying health conditions. So we've got to be getting this vaccine into their arms as quickly as possible so that we can move on to phase 1B tier 3.
Erica's question, Mayor, who's watching, this has to do with something that was a really big concern over the winter, hospital capacity. Are we still concerned at all about hospitals having to turn folks away if they reach capacity, or the hospitalization showing signs of improvement?
Hospitalizations are showing signs of improvement, but as I mentioned earlier, there's still 629 people in the hospitals today, hospitals in our region here today, with COVID positive or suspected COVID positive. So still a lot of people in the hospital with COVID. Now, a month ago, there were 300 more than that. So a month ago, we were, pretty concerned, very, very concerned about hospital capacity. With the downturn, it's still something to keep an eye on, but it's certainly in a better situation than it was a month ago.
That's all the questions I have for now, Mayor.
That's all the questions for today on this rainy, chilly Monday that we have here. So anyway, thank you all for being with us. We'll be back and talk with you in a couple of days. Always